Which of the following histologic findings is most consistent with patient's condition? 50-year-old man with a 25 history of poorly controlled type 2 diabetes presents to the clinic with complaints of progressive fatigue, lower limb swelling, decreased urine output. Blood pressure is 155/95. Lab tests reveal elevated serum creatinine, blood BUN, and then urinalysis with a proteinuria, microscopic hematuria, renal biopsies performed. Okay, so he has kidney injury. Going over this again, he has type 2 diabetes, complains of fatigue, limb swelling, so he has edema, and then decreased urine. So it's increased fatigue, swelling, and decreased urine. Those are his main complaints. Blood pressure, he has high blood pressure here, elevated serum creatinine and BUN, urinalysis, proteinuria, and microscopic hematuria, renal biopsy performed. Which of the following is most consistent with finding? Type 2 diabetes, that's probably going to lead to, that makes me think of more of like impaired like glucose filtration, so um, glomerular damage, and that
Okay.
would lead to the rest of his symptoms. So kidney injury there. Crescentic glomeruli, fibrin cap glomerulonephritis, glomerular basement membrane thickening, IgA deposition, and subendothelial immune complex deposits. Um, Again, I think it's diabetic damage, so I'm gonna go with um, the glomerular basement membrane thickening.
Okay. Final answer.
Yeah,
Okay, good. So let's talk about this, right? So, like you said, poorly controlled diabetes, a big symptom, a big risk factor, right? So, what it's going to have is these Kilmaston Wilson nodules or nodule glomerulosclerosis, right? That's going to cause, basement membrane thickening on the histology. But let's go through the rest of them because they will test that. Crescent glomeruli is rapidly progressing glomerulonephritis, usually rapidly declining renal function, hematuria, hemoprotein, but it's not associated with diabetes, associated with other things. Fibrin cap glomerulonephritis, right? Characterized with fibrin caps within the glomerular tufts, not associated with this. IgA, right? Berger's disease, usually with gross hematuria followed by an upper respiratory infection, right? So inciting event is usually a viral issue. Anything with IgA is usually dealing with viruses. Subendothelial immune complex depositions is lupus nephritis, complex of SLE, of course. But yeah,
got it.
the renal histology with the pathology, they like to connect. So make sure you have good review of these.
Got it.